Good afternoon. This is Mark Skidmore. I'm the director of the North Central Regional Center for Rural Development, and welcome to today's webinar. Today we have the webinar titled Rural Mental Health, Promoting Resilience in Farmers and Ranchers by Andrea Bjornestad and Courtney Cuthbertson. Before I introduce them and the topic in general, I just want to highlight that we do have another webinar coming up in a couple of days. And later this month, I've got them listed here, you can see. So just keep those in mind as you schedule your weeks ahead. So with that, I'll just do a quick introduction of the topic and then introduce Andrea and Courtney, and they can take over. I want to remind everybody that if you do have a question about anything that's being presented, you can type your question or your comment right in the chat section down below, and then the speakers can respond to that either while they're doing their presentation or at the end. Okay, so for the topic, I'll just do a quick review here. The Rural Family Support Network is a team of extension professionals in the North Central region of the U.S. whose mission is to address issues related to stress and overall health concerns for farm and ranch families. The network conducted a study to identify specific farm stressors that increase the risk of depression and suicide in farmers and ranchers. Levels of stress, depression, anxiety, social support, and coping behaviors were explored in the study. In this webinar, Andrea and Courtney will discuss the study results and share implications for working with farmers. Dr. Andrea Bjornestad is an assistant professor in the Department of Counseling and Human Development at South Dakota State University, and Dr. Courtney Cuthbertson is a community behavioral health specialist at Michigan State University Extension. And so with that, I'd like to turn it over to Andrea and Courtney, and thank you both for doing the work and sharing what you have.
Great, thanks, Mark. I think Andrea had a little bit of difficulty with her audio, so I think she's logged out and will log back in, but I'm happy to go ahead and get us started. So thank you, everybody, for being here. My name is Courtney Cuthbertson, and as Mark mentioned, I'm a community behavioral health specialist with Michigan State University Extension. Andrea and I are really excited today to be sharing with you the results of a survey that we did of farmers and ranchers in 4 Midwestern states. It looks like Andrea's back. So, Andrea, would you like to get...
Sure. Can you hear me okay?
Yes.
Okay, thank you. Okay. We're just going to briefly start off by introducing ourselves. I'm Dr. Andrew Bjornstead. I'm an assistant professor at South Dakota State University, and where I also serve as the mental health specialist in SDSU Extension. I've been focusing on research in this area for about probably 4 years now, and so I've conducted some preliminary studies on the mental health of agricultural producers in South Dakota, and I also travel around and speak to different ag organizations, so speaking to agricultural producers about the impact of farm stress on their mental health. So really educating them on what stress feels like, what their stress symptoms are, how do they know when it turns into depression, suicide warning signs, as well as different resources. So, so I've been working in this area for quite some time now. Courtney?
With Michigan State University Extension. My main research interest is really in how we see community and society level traumatic things happen, and they become reinterpreted or constructed as issues of individual health. So that's my big research interest area, and I have done a lot of research and programming in the area of mental health broadly, and I have been involved in hosting our Farm Stress Management Summit here at Michigan State University, which happened in January, so that folks from other extension organizations would be able to use our farm stress management programs in their local communities.
Okay, so objectives for today, we're going to talk about potentially stressful conditions affecting farmers just real briefly before we dive into our research results and work on building awareness around the mental health concerns for farmers and ranchers and kind of what the status of mental health is for producers right now. And then we'll dive into the preliminary findings from our study. Some current issues happening in agriculture. We're all aware that farming is one of the most dangerous occupations, and there's a lot of risk for injury and death working with different types of machinery. Agriculture sustains one of the highest mortality rates from stress-related illnesses, and we'll kind of cover some of those different stress-related illnesses that are most related to depression and anxiety in our study. And finally, the impact of stress on the mental health of farmers is an international concern. So it's not just a concern happening in the United States or even specific states throughout the United States. It's an international concern. We know that farmers and ranchers are experiencing high levels of stress, and this has taken a toll on them because it's been chronic stress that's been going on for years now. And we're all concerned about the economic recession that has been happening and the difficult financial declines that they've been experiencing. So different farm stressors include long days. They work long hours. Right now in South Dakota, our ranchers West River are preparing for 12 to 18 inches of snow. And so I was just reading about the risk of losing cattle and other animals during this time and how they've been preparing for that. So long days, social isolation. Some of our agricultural producers live in very rural areas, heavy workload, technological innovation, flip up there. So technology is driving forward, and some producers are confused on whether or not to join those initiatives. And whether or not they can afford them. Business management, farm administration, so they work within their farm families, and some of their family roles can get enmeshed as well. Disease outbreaks, we've had some natural disasters. If you talk to producers, they all have different opinions on government regulations and experiencing different climate changes, market fluctuations. We know market prices have been declining, as well as they also have to balance all their family roles because some of them have generational farms. This is just a picture from Ag Economic Insights that demonstrates the changes in state level net farm income. So they compared the average from 2011 to 2013 compared to now, which is 2016 to 2017. And not the most recent information, but 2017 is close. So what they found included that Iowa, Illinois, and Indiana had experienced net farm income falling by nearly 2/3. On the boundaries of the Corn Belt, so looking at North Dakota, Minnesota, and Michigan, state level farm income had fallen by more than 70%. So some definite declines in state level net farm income happening within the North Central region. As I mentioned previously, the mental health of farmers and ranchers is an international concern. So recent depression rates in agricultural workers have varied from 7.4% to 24%. I conducted 2 studies here in South Dakota, and within 2 years, my studies were 2015 and 2017. I found roughly 8%, and it jumped up to almost 18% in 2 years. So that's kind of the range, and you'll see where our regional study falls within those depression rates. We know that suicide in agricultural workers is a global concern, that suicide rate is higher than the general population with our agricultural producers. Gender differences exist. We know that rural males maintain higher suicide rates than rural females in most countries, so again, internationally. And farmers have a tendency to ignore both physical and mental health symptoms unless their work productivity is reduced. And so if you talk to physicians, or healthcare systems, they'll talk about how they're trying to figure out how to attract producers to come in and get their physical exams because, again, unless their work productivity is reduced, they are reluctant to see a physician. This is information that was published in The Guardian last year and discusses how the U.S. farm suicide crisis is an international concern. So an Australian farmer dies by suicide every 4 days. One farmer per week takes his or her own life in the UK. One farmer dies by suicide every 2 days in France. And more than 270,000 farmers have died by suicide since 1995 in India. So again, it's really trying to figure out where does the United States fall in the suicide crisis that's happening globally. Some possible contributors to the high suicide rate in farmers, again, that social isolation, being very rural, lacking opportunities for social interaction, those long work days, not taking breaks, potential for financial losses. We just saw that with the state level farm income decline, that the potential for financial losses is definitely there, and most commodity prices remain below the cost of production. Producers are also reluctant to seek mental health services, and as well as there are barriers to seeking mental health treatment, especially living in rural areas. If you talk to producers, they don't necessarily want to go see the local counselor because people will see their car at the clinic. Some people also have to travel hours to see a mental health provider, and so really working on that telemental health. And then again, access to lethal means. Producers have that access to complete suicide or die by suicide. With all that's happening, we know the farm stress, the financial losses, all of these different things. There is a negative stigma that exists in agriculture regarding mental health issues. And if you talk to farm families, they like to keep things within their family. So they tend to disclose to family members or friends rather than seeking professional help. And we actually looked at social support in this study to determine if family support is sufficient for disclosing personal concerns. Farm families may also live in isolated geographic locations in which access to mental health services is limited. So starting off to our current survey, we surveyed farmers and ranchers from Kansas, Michigan, Missouri, and South Dakota. So each state sent 1,000 randomly selected farmers and ranchers per state. So we received a list from a farm organization and randomly selected 1,000 from that list. We had a 14.8% response rate, which, you know, is somewhat low, but we were still excited for that 568 producers responded to the survey. Items included specific demographic questions, farming characteristics, and history. So we asked different questions related to how many acres do you farm, what types of livestock do you have, years of farming, if you're the principal or primary operator. So lots of questions related to their farming history. We included a farm ranch stress inventory that Courtney will briefly discuss later on, that assesses 5 different factors related to farm ranch stress. We included the GAD-7 to measure anxiety, the PH-29 for depression. We included a suicide history and ideation assessment, and this is the first time that this has been assessed in a survey of this type, and so we're hoping to really be able to provide some information on suicide risk in this population. We included brief COPE, which assesses coping strategies, but we will not discuss that in depth today. But if you have specific questions related to that data, we can certainly share it at a different time. And then we also included the multidimensional scale of perceived social support. So we're measuring support from friends, family, and significant others, so 3 different areas. Specific demographics from our study, the Age, we ranged from anywhere from 28 to 94, and our mean was 63 years of age. Gender, we had 81.2% male. Most were married at 82.8%, and again, white at 96.4%. So we did not have a lot of variability in race. We had a decent veteran size of 18.2%, and then almost, or a little over half had an associate degree or higher. As far as years of farming, we had anywhere from 0 to 80. The mean was 42. So some of them were just starting off with farming, and some have been farming for, they'll say most of their life or all of their life. So again, the average was 42 years of farming. As far as head of livestock, anywhere from 1 to 63,000. The average was 746. Acres farmed, 10 to 200,000. The average 2,326. Over half, around 61.2%, reported that they were the principal primary owner or operator of the farm, and roughly 17.6% had an off-farm job. All income from farming was 40.3%, and we did ask about pesticide use, and because in past research it has been demonstrated as a link as being related to depression. And most of our farmers and ranchers used pesticides at 87.3%. 22% reported being first-generation farmers. As related to primary commodity, 67.6% had field crops and 21.6% had beef. 34.5% experienced a disaster, and 9% experienced loss in net farm income. We were kind of surprised by this, and Courtney, feel free to jump in whenever you want. We expected this to be a little higher than 9%, but that's what was reported.
Yes, so I'll just point out really briefly that when we looked at across, we did ask what the dollar amount was of that loss, and 50% of those who had a loss said that it was $20,000 or less. So just something to think about there. So I'll walk us through some of those different questions that we asked and the measures that we collected, and then some of our results here. So the MSPSS, again, that's the multidimensional scale of perceived social support. There are 12 items in this that relate to who a person can rely on in difficult times. So there's a series of statements, and the person selects between 1 to 7, very strongly disagree, to 7, very strongly agree. I do see a quick question in the chat box. What percentage of respondents indicated dairy as their primary commodity? It was very low, I believe less than 5%. I can go back and get the exact number on that in a few minutes here. So the MSPSS can be constructed into 3 composite scores or areas, and the mean scores are shown there. So there was a higher rate of agreement in terms of being able to rely on significant others, and then family, and then friends. We did ask an additional question about who someone would be willing to reach out to for support, and this was a select all that apply kind of question. So the vast majority said they'd be willing to reach out to family. Nearly half said they would be willing to reach out to a friend. About a quarter said they would reach out to a religious leader, a pastor, or a priest. Only just under 14% said they would reach out to a medical provider, and 5.6% said they would reach out to a counselor or a social worker. And I think that this goes back to what Andrea was mentioning before around the difficulty that healthcare providers have in getting farmers and ranchers to come in general just for health checkups. And I think this also can be related to some of the stigma that exists around mental health. So the Farm Ranch Stress Inventory is a scale of 28 items about different kinds of stressors that farmers and ranchers face, and they can the respondents can indicate that these various items cause no stress all the way up to very stressful. And these fall into 5 different factors. You can see those listed here: government and external stress, work, finances, operation, and isolation. So we see that the one overall that the factor that was perceived to be the most stressful was government and external stress, and the one with the least perceived stress was around isolation. This chart here just shows some of those specific items that are part of that farm and ranch stress inventory. So 3/4 indicated that market prices for crops and livestock were moderately or very stressful. The second most stressful thing was weather, followed by healthcare costs, taxes, and then government export policy. And you can see the others that fall within that top 10 out of that overall 28. So these are the items before they get put into those 5 factors. We see high debt load was moderately or very stressful for about 37% of those who responded to our survey. So what did we find in terms of depression? We used the PHQ-9, which has 9 different items, and it's scored. The range for the scores can be 0 to 19. The average in our sample was a 3.81. We found that 70.7% of our sample had minimal or no depression. We also found that the score for depression symptoms was negatively associated with age, and that this was statistically significant. There was no significant association or difference in the finding with relation to depression for gender or for having served in the military. Related to anxiety,
I just want to jump in real quick, Courtney. Can I jump in real quick? So if you go back to that slide, if you look at mild to severe symptoms, that's roughly about 29.3% of our sample. If you go back to what I discussed previously about previous prevalence of depression in the literature, anywhere between 7 to 24%, ours is a little higher at 29.3%. But if you think about that, that's a little over 1 out of every 4 producers reporting anywhere between mild and severe depression symptoms. So think about that when you're working with your producers.
Thank you for pointing that out. I appreciate that. So with anxiety, this is another one that was scored and ranged from 0 to 21. Again, both with the depression and with the anxiety scales, this is asking about current symptom experience. So the average score was a 3.31. We can see that 73% of the sample had minimal or no anxiety, and we can see the percentages for mild, moderate, and severe. We found significant association with gender, which matches what we find the trend to be among the general population, that anxiety was higher among females than males. Interestingly, we did find an association with military service at the 0.05 level that showed that military service may be actually protective against anxiety, because the level of anxiety was higher for those who did not have any military service experience. The anxiety symptoms were negatively associated with age and negatively associated with years farming. And as you can imagine, there is an association between age and years farming. So what is a negative association? The negative association means that as age goes up, anxiety symptoms go down. So hopefully that helps. So what did we find in terms of suicide risk? This is another one where there are several items and they go into a kind of composite and make a score with a range from 3 to 17. And this gets recoded into either the person has no significant risk for suicide or they do have a significant risk for suicide. The average score you can see was a 3.83, so that is pretty low. The suicide risk was negatively associated with age and with number of years farming. So that means that as one has more years in farming, the likelihood of that risk goes down for suicide. There were no significant differences in terms of gender or having military experience or serving in the military.
Courtney, we have a couple of questions. We have a couple of questions to answer. Lori asked, how does the depression rate finding compare to the general public? It is estimated that roughly 15% of adults at some point will experience depression within their lifetime. I was searching around after you asked that question to see if I could find a specific prevalence rate, but I did not. So if anybody else in our audience has something that they'd like to share, they certainly can, but it's roughly 15% of people will experience depression at some point. Mark asked, what was the crosstab between depression and anxiety? We did find, I don't know if you mentioned this, I was searching for an answer, Courtney. We did find that depression and anxiety, 21% of the respondents had both. So there is some comorbidity happening between depression and anxiety in this population. And then Alice said, can you remind us what negative association means? Did you cover that, Courtney?
Yes. So thank you for bringing my attention to those questions.
Hey, Alice. Okay.
With Mark's question, I think our current slide actually speaks to that a bit. We did see that there was a significant association between current symptom experiences between depression and anxiety. And as Andrea mentioned, nearly 21% of the sample experienced symptoms of both. And both anxiety and depression symptom experience were significantly associated with suicide risk. So we can see for those that were in the high risk for suicide category, that included 16.9% of those with anxiety compared to 4.5% of those without anxiety. And we can see the numbers below for depression as well. So we did also ask a series of questions. Have you ever been diagnosed with, and then a series of about 10 or 12 different health issues that someone could have been diagnosed with. We did ask about whether someone had been diagnosed with anxiety or diagnosed with depression. Unsurprisingly, there is a significant relationship. These are p-values in the table. There's a significant relationship between having a diagnosis of depression and having a diagnosis of anxiety, with current symptom experiences for anxiety, depression, and suicide risk. All of these were significant. Interestingly, what we found is that 26.5% of those who did report current depressive symptoms were not diagnosed. They had never been diagnosed. And 23.5% of the sample who were currently experiencing symptoms of anxiety had never been diagnosed with an anxiety disorder. I mentioned that we had a list of maybe 10 or 12 different health issues, and these are some of the ones where we found some significant relationships. What's represented in the table are the p-values for these associations. So we found that there was a significant association between anxiety and COPD, arthritis, and high blood pressure, and maybe marginally significant with asthma. We found significant associations with the current symptom experience with depression and having been diagnosed with coronary heart disease or COPD or arthritis, and marginal significance around high blood pressure. And then when it came to suicide risk, we only found things were maybe marginally significant, significantly associated, and those included coronary heart disease and arthritis. Interestingly, we saw no significant relationships between anxiety, depression, and suicide risk related to those things on the slide: heart attack, stroke, skin cancer, other cancer, kidney disease, diabetes, and high cholesterol. And I think that some of these are a bit surprising not to find relationships with, particularly diabetes, because this is something that is a chronic health issue, and the literature has demonstrated comorbidity between diabetes and other mental health issues like depression and anxiety. So that was interesting that we found no significant relationship there. We mentioned the MSPSS. Again, this is the multidimensional scale of perceived social support. So what we're seeing here are the results of some bivariate correlations. So the R-squared value is showing us the directionality and the strength of that association. The p-value is showing us the significance level. So what we see with the relationship for significant other, family, and friend, these are all significant, and they, except for significant other impact on suicide risk. They're negative, meaning that the more social support is perceived, the less the symptom experience, or the less of the risk here. And the values being in the 0.1 to 0.25 range, that's a weak association, but it is statistically significant. And we see that the strength of that relationship is strongest with friends. So having support from friends related to anxiety, depression, and suicide risk. We also looked at some bivariate correlations between scores for the 5 factors from the Farm and Ranch Stress Inventory. So again, the R-squared is looking at the strength of that relationship, and we see that for anxiety and for depression, that those are in the 0.3 to high 0.4 range. That's more of a moderate association, and these are positive. So the way we can think about this is as these factors are considered to be more stressful, the anxiety and depression symptoms would go up. As government, work, finances, operation, isolation are considered more stressful, the suicide risk also goes up. But we can see that it's more of a weak association with the suicide risk. So again here, we see the strongest, we see some, that must be a typo, I'm sorry about that. We see some strong associations in terms of government, work, finances, and operation, and the least impact from isolation, if we consider variations among those 5 factors. So again, these are perceptions of how much stress these factors cause. So things that were included in isolation, that factor include things like lack of close neighbors, distance from shopping centers, schools, recreation, and other things, limited social interaction opportunities, and distance from doctors or hospitals. So some of the things that we think are important to pay attention to, and again, these are preliminary results. We have quite a lot of data that we're working with here, which is very exciting. But some of the things that we are making sure that we're keeping in mind here are the comorbidity between anxiety and depression. And then, interestingly, this importance of friendship, that friendship really can be protective here. Andrea, did you want to add anything to this?
No, I just think that when you're working with producers, it's important to discuss what their social support system is, who is in their social support system, and sometimes I think they just assume that their family business, if they farm with their family, that can be sufficient. But what we're finding, and this is a replication of a previous study of mine, is what we're finding is that those that have higher depression and symptoms lack friendship. And here we found it with anxiety as well. And it was highest in suicide risk, actually. So again, that importance of friendship. Do they have friends outside of the family farm? And some people will report that some of their closest friends are their ag loaners or people that directly work with them in agriculture. So again, the importance of friendship. And the comorbidity between anxiety and depression, I think, says a lot, because a lot of what's been being pushed to the general public right now is the concern related to depression. But there is just as high of a concern related to anxiety, and trying to determine how does anxiety relate to suicide risk as well. So we can't forget anxiety either in this process. It has to. We really do have to start thinking about both of those conditions.
Thank you. And I see Mark's question, what about government is stressful? What's included in external factors? So that government and external stress included things like government export policy, government farm price supports, market prices for crops and livestock, taxes. It also included things like the weather, financing for retirement, and then outsiders not understanding the nature of farming and ranching. So those were the things that were all included in that factor. So we do want to share some resources in case there are some of you on the line who work directly with farmers or ranchers, or really in case you're aware of anybody who might be struggling with mental health. We include a number of resources here. The National Suicide Prevention Lifeline is a wonderful resource. It does have suicide in the name, but the trained staff that answer the phones will talk to anyone experiencing any kind of distress. I've actually programmed this phone number into my cell phone with an asterisk at the beginning, so if I need to use it, I know where to find it. It's immediately at the top of my contacts list, and I don't have to go searching for it. The National Suicide Prevention Lifeline has a crisis chat as well, and then there's the crisis text line in case someone would be willing to text, but not they don't want to talk to someone. Again, the folks on the crisis text line are trained and know how to respond. The National Suicide Prevention Lifeline runs a veteran crisis line as well, so it's the same number, but when you when they pick up the phone, you press 1, and then it'll go to folks who have experience working with veterans and might be veterans themselves. There's the Iowa Concern 24-hour hotline, and then the Farm Crisis Center. All of these might be useful resources. And then we also want to mention some resources that Cooperative Extension has available. I mentioned these a little bit earlier, the MSU Extension Farm Stress Management Workshops. There are 2 of them. One is Communicating with Farmers Under Stress, and this is a workshop to build up knowledge and skills around how to work with farmers facing stress, including identifying signs and symptoms of stress, some useful tips for communicating, and what warning signs of suicide are. And this is for someone who might work with a farmer in a professional capacity. Weathering the Storm is the other workshop that MSU Extension offers, and this is for farmers and farm families themselves and helps to identify signs of stress and talks about how to manage those stressors as well as signs of suicide and how to get help. Andrea's created some really great resources through South Dakota State University, and one of those is called a 5-step approach to alleviating farm stress. The link is there. It's a very good resource. And then finally, North Dakota State University Extension has a handout called Responding to Distressed People, and it is a flow chart of, okay, I see this situation, and these are the things I think are going on. What should I do about it related to mental health? So we want to make sure we have time for more questions and conversation, and thank you so much for being here today.
Thank you, Courtney and Andrea. So we do have a few minutes, and we'd love to hear your questions or comments. I guess we can't really hear them. You just have to type them in the chat. But let's... we see some people typing right now, so if we can just hang on. There they start. Why don't you go ahead, Andrea and Courtney, to answer some of the questions as they come in.
Sure. So the question is, can the recording of this program be shared through social media? Mark, that might be a question for you, actually.
Yeah, we will. We're recording it now, and we will post the recording on our website, and from there you can just share the link however you like. The recording should be available within the next couple of days.
Becky, thank you for the correction on the link for the publication Responding to Distressed People. I appreciate that. We have another question. What are the programming implications of this work? I wonder if you could share more about what kind of programming you mean by that. I think there's a lot of ways we could think about that question. So how can we, it's package programming for consumers. Well, so Andrea and I were talking about this ahead of the webinar, and I think one thing that our work really points to is the importance of a holistic approach towards health. That there are some connections between mental and physical health, and that we have to come up with innovative ways to reach out to ranchers and farmers and encourage that help seeking, encourage that health care. Andrea, do you want to comment on that?
Sure. I think some of what I've been discussing within Extension is, especially on the ag side, that we put together programs for producers, but we don't allow them time to actually process a lot of the information they get, as well as have that social interaction time. When I speak to farmers and ranchers, it's amazing. They'll pass around the microphone, they'll share their stress, and sometimes they just need opportunities to share their stress. So, we like the packaged programming. I think that we need to develop something on anxiety. We've been doing a lot on depression, but we're seeing the comorbidity of both. And Courtney, you can correct me if I'm wrong, but this is something we need to analyze a little further with our data. But it was being shown that anxiety was more related to suicide risk than depression in this sample. So really thinking about anxiety within this population and trying to do some programming there. But a lot of it is allowing time for them to develop those friendships and sharing their stress with one another and sharing what's going well, what's not going well, what are they struggling with. So again, promoting those social opportunities is so important within whatever type of programming you're doing. I don't know if that really answers your question, but again, we're diving more into this. We have a lot of data that we still need to analyze. So I think that the next step would be to focus on anxiety, to be honest with you.
Thank you. Yeah, go ahead. Sorry.
I'm sorry. Yeah, I was just going to say participants probably will see the summary evaluation while we're continuing the discussion. We really appreciate your feedback. So please complete that. Go ahead. I think there are a couple of other questions here.
Great. Thanks, Mark. So was there any detail behind healthcare costs as a stressor? No, unfortunately there wasn't. It was included in the farmer rancher stress inventory, but we didn't ask for any more detail on that, and we didn't have any other written-in comments. We did send this out as a hard copy mailed survey, and we had an opportunity for people to fill it out electronically, but the response was very low to that. The vast majority of the surveys were returned in hard copy. So there was an opportunity for people to write in the margins or write in other places, and we didn't see that with relation to healthcare concerns. So is there a full copy of the research survey available? There's not currently, and another question, have you published your study yet? We have not published this yet, but we are working on it. From what we've presented today, you can see we have quite a lot of data that we are dealing with, and we're looking forward to more deep dives on some of the different associations and relationships between these variables. There's a question here, is there a specific crop or item that is losing most of its value? I think that would be interesting data to pull in and associate with our responses to see how that plays out. We did ask about what the primary commodity is that people had, and also secondary commodity, and the two biggest groups, as Andrea mentioned earlier, were field crops and beef, and we did look to see whether there were any associations between those two primary commodities and experiences with anxiety, depression, and suicide risk, and there were no significant associations there. I did also look into the relationships between those primary commodities and the different health outcomes, and there were no significant relationships there either. Someone before asked about what % of the sample were dairy farmers, and it was quite low, and unfortunately I think too low to be able to get much specifically about dairy farmers out of our sample, which is unfortunate because I know that dairy prices have been one area that have fluctuated quite a bit and lost, it's harder, the level of income that people are gaining from dairy is much lower than it was in the past. So then we have a question, are state-specific results available? We have not made them available yet, and I'll just give a reminder that this survey was conducted in 4 states, in Michigan, Missouri, Kansas, and South Dakota. Andrea, do you want to add anything?
Not at this point. Does anyone have any other questions?
Well, I don't see anybody typing any other questions in. Maybe now is a good time to stop and thank everyone for participating in the webinar. Andrea and Courtney, thank you so much for sharing this important information. We really appreciate your time and all the work that you've done.
Well, thanks, Mark. We really appreciate it. We're glad to share what we found.
Yeah. Well, okay, so we'll call it a day for the webinar, and we'll sign off for now. Thanks again, everyone.